Welcome to myTRIAList Trial Talk, Voices of Experience.
Hi, my name is Catherine Martin. I am a 50-year-old single parent. I learned that I was stage 4 colorectal cancer with tumors in my liver and the largest tumor sitting in my rectum. I spent 6 months in chemo to try and shrink the tumors in my liver. And then I underwent a liver trisectomy where they removed 75% of my liver. About 3 months after that, I had the colorectal surgery. And for a period of 4 or 5 months, I was actually no evidence of disease. Unfortunately, after that, I went in for a checkup and they found small nodes developing in my lungs. And it was later determined that those tumors were actually the cancer, which had come back.
What was it like to search for a clinical trial?
I didn't get offered any clinical trial opportunities from my oncologist or from the cancer center that I was working with. I talked to a lot of friends. I reached out to someone that I knew that worked at the NIH and used their website. I kept finding that there were a lot of questions about my own disease that I didn't have the answers to, questions that would have either precluded or included me in a possibility for these trials. And it was a tremendous amount of work, particularly when I was also in treatment, also working, and also trying to take care of my family. I did find an institute in Tennessee that was willing to pre-screen me for any of their colorectal cancer clinical trials. I ended up going down to Nashville, meeting with the doctors there and having my tumor types, some of my biopsy materials and other things sent to them so that their team could look them over, and was lucky enough to find a match in an immunotherapy trial.
How did you feel about clinical trials before enrolling in one?
I didn't know much other than I know they've provided great relief for some people. You hear more about the positive stories than anything else. So for me, it was sort of a potential and a hope that maybe didn't exist in my standard of care treatment.
What was the clinical trial enrollment process like?
The enrollment process included a series of CAT scans, MRIs, blood work, and then consent. It was about a day and a half of tests. I think I also had an EKG and maybe a stress test. So a lot of kind of physical things on the front end. I believe they also required tissue sample from previous biopsies. So, so all of those things had to be gathered. I think a team of microbiologists then looked at my tumor types, looked at my tumor tissue, and looked at where I am currently versus when I was initially diagnosed, and then the standard treatment that I'd received from diagnosis to the enrollment, and that was kind of how they decided if and when I could join the trial.
Did you experience any challenges in meeting all of the eligibility criteria of the clinical trial?
I actually was not accepted for the first 2 trials that they had suggested for me. So yes, each one of those required an extensive pre-screening process, all of which was to be done 5 hours away. And then, to learn that I somehow had not met the criteria. So yes, initially there were 2 trials that had been specifically selected for me, but that I ended up not being eligible for.
Why did you decide to enroll in a clinical trial?
When I was told that I potentially had 10 years to live as a prognosis, and that I would be in the same kind of chemo throughout those 10 years. I felt like that wasn't really the answer I wanted to hear with young children and a family. I felt like I needed something better than that. I loved the center. I was excited about the trial. I felt like I had been personally selected to be a part of this group because there was a lot of potential. And I really liked the physician and the lack of side effects versus chemo.
Did you face any barriers when deciding to enroll in the trial?
So I started this clinical trial. I found out I had been accepted probably a week after I had accepted a new job. And I was very concerned about how that was going to be taken, and as a new employee without vested benefits, and knowing that every 3 weeks there would be this disruption where I would be gone for at least one day or two for this trial. It gave me pause, and I was concerned about signing up for the trial and then not being able to commit or follow through. But I was lucky enough to be able to talk to my HR department and my boss, and just preemptively sort of let them know what was happening. And we were able to make arrangements so that it did work. But that was a big consideration. In addition, I'm a single parent, and so making sure that I had my younger children taken care of during times when I was going to be out of town for treatment.
Can you tell us about your clinical trial experience?
This immunotherapy that I was receiving in the trial was teaching my immune system to identify cancer proteins and then destroy them. I had no requirements at home. My only requirements were that I be at the clinical trial center every 3 weeks. I was required to have extensive blood work, meet with the doctor or physician assistant, and then I had a 30-minute infusion, after which I was monitored for an hour. And then I was free to go. Beyond that, I think any symptoms that were out of the ordinary, any other slight signs of sickness or something being off, I had to report back to the clinical trial center.
What was one thing you were surprised to learn about clinical trials that you didn't know?
The lack of connection with outside treatment. When I joined my clinical trial, all of my care, including what typically might have gone to a PCP, was handled by my clinical trial team. And that put a significant amount of control in their court, particularly when they were out of state. So that, provided some challenges, but yeah, I think that was probably the thing that surprised me the most.
How did you find support throughout the clinical trial process?
I am a member of Fight CRC, which is Fight Colorectal Cancer. I was an ambassador, a patient ambassador in 2021. I also talk to other patients. I think sometimes they're the best sounding board, particularly if they have been in clinical trials. And then I also leaned on my family a good bit.
As a parent, how did you talk to your kids about your treatment decision?
I tried to be as honest with my children as possible, mostly because I think if I'm not, they start to create stories in their own head, and usually those are far worse. But when I sat my children down and told them that I had this potential to be in a clinical trial, I did approach it as something I was very fortunate to be a part of, something that I was, um, really lucky to have an opportunity to join in on, and also something that, had been personalized for me. So instead of sort of treating to the middle of a large group of patients, I felt like this was an opportunity for me to get personalized treatment where people were looking at me as an individual in this trial and how I was responding versus me as a cancer patient in a much larger pool.
What questions would you tell someone that is considering a clinical trial to ask their doctor?
I think anyone entering a clinical trial needs to be, they do need to have their doctor's consent or approval. If their doctor is someone that they trust and believe has their best interest at heart. I think making sure that a clinical trial is far enough along that that there are positive results for you, that you would be an ideal candidate for this trial, that you don't have some sort of outside or additional malady that might be affected by this trial, but also, is it convenient, and will it improve your quality of life? I think that's really the big thing, particularly for cancer patients.
Was enrolling in a clinical trial the right decision for you?
Yes, 100%. For me, as I said, it gave me a hope. It gave me a reason to believe that there could be relief. And it also gave me almost a full year break from chemo, which was destroying my quality of life. So for me, looking at the difficulty of travel and the logistical arrangements versus, dealing with some of the side effects of chemo, that was a no-brainer.
How did you take care of your mental health throughout the clinical trial process?
Seeing my therapist is something that I make a great priority. She's actually very, very sort of entrenched in my treatment and what's happening, and it's something that I've made a priority as much as my, chemo treatments or anything surrounding cancer, because without hope and without the ability to really kind of understand what's happening with me emotionally, I don't think my body would respond as well as maybe as it has for me, with family far away and having moved many times and sort of being a transplant in the city I'm currently in. It was really helpful for me to be able to have a private group on Facebook that I could update with a lot of kind of real and raw emotions, and be able to explain what was happening as it happened. It was particularly helpful during the pandemic. I think what I've learned is that wasn't just helpful for my community, but it was really helpful for me. It was helpful for me to be able to voice some of the things that were going on. It was helpful for me to be able to remind people that colorectal cancer it's a killer, and it snuck up on me, and hopefully if I've stopped it from sneaking up on one other person, I'm thankful for that.
What advice would you give someone who is having a hard time deciding to enroll in a clinical trial?
I think it's very personal. I think it has to be something that you are enthusiastic about, and something that you feel has the potential to make a positive change. I think it's really easy to get mired in what everyone around you is telling you, from friends to family to your medical team. But I think, after you've looked through the facts, I think that you certainly need to do what you feel is best.
How has the clinical trial impacted your quality of life?
I did not have any symptoms from the clinical trial infusion. So for me, um, any of the symptoms that I was suffering from in chemo, um, joint pain, loss of um, use of digits, and neuropathic pain, hair loss, rashes, all of those things were gone. Physically, I felt fine. I felt great. And then emotionally, I think that, when you feel good physically, that certainly plays into your emotional well-being as well. I mean, I was able to vacation with my children. I was able to, go to graduations. I was able to participate in life on an everyday basis. And that was something that I wasn't really fully able to do when I was in chemo.